The COVID-19 pandemic has resulted in people with pre-existing conditions not keeping up with their prescriptions and not attending their clinics and/or doctors for regular checkups, partly due to fear of venturing out during this time. This has been noted by healthcare professionals who have urged people to continue to take care of their well-being. Well, to discuss this matter further, I'm joined by Dr. Francesca Conradie. She's from the Clinical HIV Research Unit at Wits University. Thank you so much for joining us, Francesca. So what have your observations been around people who have pre-existing illnesses and their willingness to get treatment during this time of COVID?
So the area that I'm currently working in at the moment is one of TB research. And we have noted that the number of TB diagnoses has dropped by almost 50% in the last 2 months. TB has not disappeared, that's for sure. It does mean that there are lots of people who are undiagnosed and are not going to the clinic. In addition, people who are HIV infected, their number of visits have also dropped.
So, Francesca, now
Please,
yeah.
I'd like to urge the public with the following. Please go to the clinic if you need your chronic medicines.
Yes, yes. Now, the reason for the concern is that, of course, if you have pre-existing conditions, it could result in complications. Isn't that right?
That's 100% correct. That people with HIV, with TB, diabetes, or hypertension are more likely to have a poor outcome with COVID infection.
Now, Francesca, you're also concerned
but
about...
we work very hard with our clinics opting.
Francesca, one of the things that you mentioned is that you're concerned that parents are not taking their children for scheduled vaccinations as well.
That's correct. There's a startling statistic that when there was an Ebola outbreak, more children died from measles than from Ebola. And measles is a preventable disease. So please, if your children are due for vaccines, don't skip them. Go to the clinic. They're observing social distancing.
But Francesca, isn't part of the problem...
Wear your mask, wash your hands.
Yeah. Francesca, isn't part of the problem that stations like ours and other news media are reporting or reflecting what is happening in the country, that a number of health workers are becoming sick? Where they get the sickness from, we're not sure, whether it's in hospitals or when they go shopping. But the bottom line is that a lot of them have been contracting this disease. So it creates a fear that if you go to places where those people work, then you can become sick. So what do you say to people who are watching who are concerned?
So we've adopted a universal masking policy. All of us must wear masks. And the reason that we wear masks is not for our own health, but to protect people we come into contact with. So healthcare workers, yes, they are contracting the disease, but the fact that we are using good infection control measures.
Yes, no, absolutely.
Make healthcare facilities place to go.
Francesca, I'm sure people are listening and hopefully they will take heed because, of course, like you say, COVID is not the only issue that we have to contend with. There are other viruses and illness and conditions that people must take care around. Thank you so much for your insights there. That was Francesca Conradie. She's a researcher in the HIV wellness area at Wits University.